That has rice? I'll take 2 of them, but 1 of them with no vegetables.
Whatever one.
Hello, hello, testing. Is this on? I think we're on. Looks like we're on. Hello everyone. How are you guys doing? Sorry it's been a bit since I've posted a nursing video or some form of nursing content. Where I like to tell you about my journey so far. I've just been very busy with the schoolwork and everything. It is an accelerated program, so I had to log in a lot of the times, and with the minimal time that I have, I spent a little bit on streaming and playing games to just to relax and a little bit. If you want to go check it out, feel free to look at my Twitch or my live category on YouTube. For those of you who don't know, my name is Remi. I am a vtuber / streamer, gamer, nursing student, IRL. Feel free, if you want to know more, feel free to go look me up or ask questions in the comments. Yeah, let's get right into it. I feel like I'm so behind on everything. Just been trying to catch up on work and stuff. So much homework due. There's just stacks of books to read, and then sometimes professors would add like more homework out of nowhere when it's not even posted online yet. They're just like just right on the spot. So I've just been trying to catch up with everything. Yeah, sorry, this is my dad. I was just checking something. Yeah, I get distracted so easily. I think I'm just a silly bean, awkward bean. But yeah, I hope you guys are doing well. How is everyone? If you have any questions about like nursing school stuff, I'm only like 8 weeks in, so I might not know much. I am a freshman in nursing school. For my last video, I think I talked about my acceptance into nursing school and stuff, but then I planned on uploading like first month or first week, and I just couldn't get to it. It's just too much work to do. But I'm thinking, why not make maybe 8 months is like 8 weeks. 8 weeks is like 2 months, right? Yeah. First 2 months of nursing school. Still my first semester. It's a summer semester. We are set to graduate by September 2026 next year. Since it's an accelerated program, it's 16 months. But yeah, we're on our 8th week right now. No, actually, today is Tuesday, so that would be the start of our 9th week. Next week there's another test coming up, so oh my god, you guys study for it. But yeah, from where I left off, I don't think I talked about my orientation. Okay, let's go all the way back to our orientation. So I had my nursing school orientation like the week before the semester starts. So I learned a few things about my school. It's fairly new. It's only been around for 5 years. 9 cohorts have graduated so far, with the previous one all passing their NCLEX exams first try. So that proves that this school is pretty good, and they are starting to implement their PhD programs too. So there's bachelor's in nursing, there's master's in nursing, and there's PhD in nursing. So this school is evolving, I would say, but it's still fairly new. Teachers are not sure if they're new. Like I would say they're new since school is new as well, but they're doing pretty good for having a 97% pass rate for the last cohort. I think that was cohort 12, 11, I think, or is it 9? But my cohort is cohort 13. We are in our first semester. We're freshmen. We just finished our 8th week. We're starting our 9th. Today is Tuesday, our 9th week. Yeah. So in August of next year, we will graduate. Hopefully everyone will graduate at the same time. We're all helping each other. I love my class. Everyone feels like a family here. We help each other so that no one gets left behind. Any questions you need, my classmates are there for you. They're like my siblings, you know. And then September, after we graduate, on September of next year, we will take our NCLEX exam, which is an exam to get us certified to become actual nurses. Yeah. Last week I just had my first ever clinicals in my entire life. First ever clinicals. That means real hospital, real patients for the first time. And first day. It was last Thursday. I was at this nursing home. So I think we're starting out with nursing home, and eventually we'll do clinicals at a bigger and bigger hospital. But yeah, my first time at a nursing home with real patients. We weren't allowed to do a lot because we're students, of course. But we were shadowing our CNAs, which is certified nursing assistants. My professor assigned everyone a CNA for each of us. I will be posting another video talking about first day of clinicals, so be on the lookout for it. Or you can watch the previous live gaming stream where I started off with just chatting category of talking about what happened during clinicals and everything. I'm going to cut the VOD and upload it as a separate video if you guys want to watch it, just for that. So we have some nursing content coming. I want to do more, of course, so be on the lookout for more. I'm gonna try to post them at around 9 a.m. I'm gonna schedule it the night before, because 9 a.m. I'm already in class, so I won't be posting. But I'll schedule it and it'll automatically post, so you guys will have something to watch. Mainly, I kind of want to just do like vlogging or talking about my day, like a diary or something, or just learning to yap and talk to you guys. Talk to my fans and everyone. I'm still new to this whole chatting, streaming kind of thing, or gaming and everything. Back in the day, I do a lot of ASMR. I don't know where the VODs are, but back in my day. Anyway, but yeah, considering all of that, how I started out as, ASMR and all of that stuff, I'm quite new to gaming and chatting and all of that variety content, so please be patient with me. I hope to do better for you guys. Yeah. During orientation, all the professors were introducing themselves. All the students in my class were introducing ourselves. We have a person in class who can do like all sorts of like karate, kung fu, taekwondo, all that stuff. So, and he was also like a gym PE teacher. Like everyone's like, hey, we have a personal bodyguard, let's go. And then yeah, everyone was introducing themselves. Most of the people in class are older than me. I feel like that's normal though, you know, like I don't know why people feel like weird to be in school when they're older. I just feel like college is for adults of all ages, you know. Anyway, I thought that was pretty cool. There are some that are younger than me, there are some that are older, some have like children, some are experienced in like they're already seeing A's or LVNs and stuff, and I have no medical experience, but I am the only math major in class because I was a nursing major, then I switched to biology, got my degree, then went back to nursing, and here I am, I'm in nursing school. So yeah, I am the only one with a math degree in class. And then after that, they were talking about things to, you know, generally expect of what will happen in nursing school when we'll graduate. What is clinicals? What is all that stuff? They talked about how nurses, future nurses, or as nurses one day, we should learn how to like find things to help us relax because our health matters too, and if we can't take care of ourselves, we don't know how to be healthy mentally or be alert and all of that stuff, the person who's gonna suffer the most is our patients, you know. So yeah, they talked about that. They talked about how pediatrics is in big demand, which is a topic, a category that I am interested in. Most likely I will probably be a pediatric nurse, some kind of maybe OBGYN babies or that. Not sure, guys. I'm still deciding. The first time clinicals that we had last week, it was intense. I was left alone, but like, you know, it's busy, so I get it. I was left alone at some point, and then there was an emergency light from one of the patient rooms light up, and I ran to them and I took initiative. Don't worry, it's safe, because if there's something serious, I would probably call a doctor or actual nurse to come over. But yeah, patients wanted to like throw up, so I ran back and forth trying to find a bucket, all of that stuff, taking care of patients that are not even assigned to me. I went around asking if anybody needed help. But yeah, it's like a whole separate video. I'll be talking about that. But yeah, I don't know, guys. I might like ER or NICU kind of nurse, you know. But we'll see. I have a long time to decide. But yeah, they say pediatrics are in big demand. We are supposed to be at, when we have clinicals, which is I'm talking about orientation, where they're like introducing that we have to go to clinicals. And so yeah, clinicals is 12 hours, and I live 2 hours away from school, so I have to wake up even earlier and sleep even earlier than all of my classmates. I am the one living farthest away, so a lot of the times that I'm supposed to be studying, I'm on the road driving. So driving 2 hours to school, and then 12 hours at clinicals, and 2 hours back. So during clinicals day, I won't be able to do my homework because I'll be so tired when I get home. But other days, I usually cram a lot of all of my homework, which is not recommended, but you know, I live very far, so I don't really have a choice. Like a lot of my classmates live near the school, right? 5 or 10 minutes away. They can sleep at 12 a.m. if they wanted to, and wake up at 8 a.m. and go to school. School is 8:30, you know. Me, however, I would wake up at 5 a.m. Go to school, be there around 8, because you know, gotta account for traffic. And then school would be 8 hours. Or if we go to clinicals at a real hospital, it would be 12 hours, and then another 2.5 hours to go back home because, you know, traffic again. I wake up around 3 or 4 or sometimes 5 a.m. and then I get home around 7 p.m. or 9 p.m., 10 p.m. So there's not much time to do homework. So usually when we have weekends off, I cram all of it into the weekend. But yeah, not recommended, guys. But yeah, that's what I've been doing so far. So far, so good. I'm surviving and managing, learning how to manage my time better. Still working on it though, but getting a lot better. And during orientation, we also went over like incivility, which is not professional. And they talked about like being professional, having emotional intelligence and empathy, or being respectful towards one another in the workplace and towards patients. Because if there's a negativity in the workplace, then who do you think suffers the most? Our patients. And we don't want that to happen. So yeah, they talked about that, which is I really like that, you know? I hear a lot of stories from other people. Like, I don't have medical experience, but I'm always interested in what my classmates or other people say. They talked about how there's like mean nurses or stuff, you know how nurses eat their young. But yeah, I'm very glad that schools are teaching this more. You know, I like to spread kindness and positivity, and you know, I want to see that more in the world, you know. Anyway, let's keep going. We talked about personal accountability. We talked about how there's a student website where we can go and check our homework and stuff, turn in our homework. They talked about how we have to take the ATI test. ATI test, which determines if we are able to pass the NCLEX exam on our first try, second try, all that stuff, you know. So you have to pass the ATI test, and then you have to take the NCLEX test to become an RN. Yeah. And then we talked about, yeah, you know, mind-body practices, you know, sound therapy, aromatherapy, whatever helps you relax, you know. For me, it would be video games, because that's my hobby, you know. That's what I like. That's what makes me happy. That's what makes me relax. Like playing a Souls game, you let out all your frustration. You defeat the boss, and it feels nice, you know. I'm a gamer, yeah. And sometimes I'm pretty sure I have other hobbies too, but right now I'm really into gaming and stuff. Feel free to check out my streams. That would still mean a lot. You know, just being myself. And we talked about how we will get our books in the second week. And they say you should bring your laptop every day, because you never know if there's a pop-up quiz, pop-up test. And all the tests that we're gonna take in class is gonna be online on the student website, so we need to get our laptops. But yeah, that's what happens during orientation, you know. We get to meet all the professors, meet all the students in class. Yeah, some of the students that we met during the interview, which I talked about in the previous video, some of them were not in our cohort this semester. I think because it's full. I think they're in like the next semester, cohort 14, cohort 15, and all that. Yeah, I am in cohort 13, so yeah. Okay, and then we got our books. It's like stacks of books. If you looked at my YouTube posts or social posts or Twitter or Discord, I'm on Discord a lot and Twitter. You'll see that I posted a picture of like a whole stack of books that I have to read. We all have to read, and all the words in each page is so small. Like they're trying to fit everything in there, so you can imagine it's a lot to read. And yeah. So we talked about the difference between me living far, my classmates living closer. Yeah, I have to cram, and I have to, you know, spend a lot of time driving, which at first was really fun, and then it starts getting draining on you. yeah, that you know, it's only 2 hours away. You just kind of just go straight. Sometimes I try not to fall asleep, so I put on like music to wake me up. Or I would love to listen to lectures and or YouTube videos on nursing stuff. Here, listening to people talk while on the road, but I'm scared I might fall asleep. So I'd rather do that when I'm like at home or something. But yeah, and then we probably in the first or second week, I think we got our books, and then we had to choose like 4 class presidents in case like one person's absent and all of that. I was one of the class presidents. So I was chosen as class president, and my 3 other classmates were chosen as class presidents as well. So anything that the students have complaints or want to improve about the classroom, anything they want to communicate with the professors or the staff, the principal, like we talk to them for our classmates. The last Tuesday of every month we have a meeting with the principal, with the professors, and we just come together and talk about what's working and what's not. Like this school is still pretty new, even though it's really good. It's a private school, so I have to pay a lot for tuition. Of course, I'm using financial aid, so I'm gonna have to pay it back once I graduate and start working. I do plan on getting a BSN eventually, and after that, I'm going to decide on if I want a MSN or PhD or go straight to medical school and become a doctor. Because lately, I've been low-key thinking about becoming a doctor. When I was in my senior year of high school, I've always wanted to be a pediatric doctor or some kind of cardiologist. But I don't know. Maybe we'll see. Feel free to follow along my journey and look at like nursing content, in real life stuff, vlogs. I don't know. Maybe we'll go to medical school and start that journey as well. But yeah, first we gotta get through this nursing school first, guys. Still in our first semester, 8 weeks in, and oh my god, things just keep coming. Like homework, tests. Last week we had 4 tests, I think, 2 quizzes, 2 take home, 1 quiz and 1 test. It was a lot on top of all the homework to do on the same day as well. But yeah, sorry I've been so locked in that I just didn't have enough time to upload a lot. But I'm gonna try to do more for you guys. So just be patient, be on the lookout. It's not that I forget about you guys or anything. I've just been planning, in my head, like what to say, what to post, how will I edit stuff, or what to say, But definitely it will appear on our channel. And then yeah. And then today I just finished I got checked off all of my clinical skill practice. You know how we practice with mannequins and stuff? I learned how to do vital signs, perineal care, bed bath, bedpan, urinal, oral care, hygiene. I learned how to do physical assessment, checking for their neurology, their brain. Are their patient alert? Do they know what day it is? Checking their pupils, all that. I learned how to use the stethoscope. I learned how to give injections. I learned how to palpate, auscultate the heart, the lungs, the abdomen. Because apparently you have to use the stethoscope on the abdomen as well. The mannequins that we saw, some of them could talk. I think it's someone in another room talking to the mannequin. I'm pretty sure. Some of them can blink, some of them can move. But yeah, very high-tech robots. But just last week, we had our first ever real hospital, real patient clinical day. So I thought it was really fun, I wanted to stay longer, but I had like 12 hours, but I had a lot of fun. I think it's just my love for wanting to help people and saving lives and taking care of people. You know, I think I'm very nurturing at heart. So yeah, I had a lot of fun. The patients really liked me. I want to tell you guys so much about everything. I don't know how long this video is gonna be, but I'll try to break it down. But yeah, look at the next video that I'm going to post, and you'll see what I'm talking about. Sometimes at the beginning of stream, I like to do like just chatting and just talk about my day, my week, what's happening in nursing school, all of that stuff. So if you guys do tune in and you guys want to hear about it, you can stay for the beginning portion where I talk and stuff. And you can, and of course you're welcome to stay for the whole game. I usually like to, lately I've been into Souls gaming, so I'm a little hardcore lately. But I also like Animal Crossing, all of that relaxing games and stuff, you know. So yeah, I learned how to do suturing, removing suture. I learned about pressure injury, how to do taking care of wounds, you know, how to tell the difference between stage 1, stage 2, stage 3 and 4 of pressure injury. Learn how to do injections, medication. We did med math tests, which I really liked, of course. Passed that as well. I learned how to do apical pulse. You know, there's like, I think there's like for example, you can check your pulse on, I think your radial, your ulnar, your pedis under your feet, on your torsalis piece, your ankles or something, and your behind your knee, so popliteal area, the femoral area, which is like between your thigh and your knee, that top part of your feet, and then your brachial, carotid artery in your neck, you know, all that stuff. I learned how there's different places for your body temperature, like your mouth, oral, your tympanic, like around your cranial, your head area. I think, was that tympanic, or is that behind the ear? Tympanic. Yeah, I think that's behind the ear. Whoops. Behind your ear. I think your temperature, your axillary, that's your armpit. I think on your and around, and like anyone in your butt, you know. Yeah, like that. I learned how to like administer oxygen, blood pressure, all that stuff, you know, how to do restraints. We learned about a bunch of different restraints as well, on the chair, on the bed, and the hand, and you know, yeah, pretty cool stuff. I learned about things like, if you have a lot of patients, which one do you take care of first? And of course you have to take care of one that's like who has the ABC, which is A is for airway, B is for breathing, C is for circulation, so like your blood, your lungs. Any patient that has a problem with that part of their body, we have to tend to them right away, because that's survival stuff, you know, that's really important. So those people are like emergency. And then we learned about Maslow's hierarchy of basic needs, like physiological needs, safety and security, love, belonging, self-esteem, all that stuff, you know. Of course, physiological needs is the very first one. We learned about ADPI. So nurses, I hear they will really love their mnemonics. So ADPI, A stands for assessment. You gotta assess the patient. Are they alert? Are they okay? Do they have any bruises? What do you see? What do you assess? What do you inspect? And then D for ADPI, D would be to diagnose, you know. That is, interpret the information you saw. So they have a bruise. Why do they have a bruise? You know, stuff like that. Oh, they're unwell. Why are they unwell? Are they coughing? Do they have a fever, infection? You know, stuff like that. And then P would be plan. Now, how do you help them? what medications do you give them. And of course we learned about like you gotta make sure it's the right patient, the right dose, the right amount, the right time to administer the medicine, because times are important too. What else is there? The route of medication, because some are like on your skin, like cream, some are in your mouth, like tablets, some are injections, some are I can't think right now. I just got home from school, so I'm a little worn out. So stuff like that, and then I would be implement. So now that you have a plan, you know what's wrong with them, now you implement it. That means you have to start taking action. They need a tablet, give them a tablet, implement your plan. And then E, the last one for AdPi, E would be evaluate. So that's when you document stuff like, okay, you did this, you did that. What do you see? What conclusion do you come to? Like, stuff like that. How would you evaluate what just happened, Yeah, you learn about that. Learn about using like protective clothing, like different masks, your gown, your gloves, all that stuff, because you don't want to spread infection to patients, especially patients with like holes in their body, like the tracheostomy in their neck to help them breathe. Maybe there's a tube in their stomach, stuff like that. Any patients with an opening in their body are more at risk of infection. I sound like such a nerd right now. And then we learned about stages of infection. We learned about pneumonia, asthma. We learned about the heart. We learned about a bunch of medications. Just the heart alone has so much medications. Like, we have to remember all of the scientific names, their pharmacological class. Are they antibiotic? What's the name of the antibiotic? Are they albuterol for asthma? I have asthma, and so like it's a corticosteroid. You have to wash your mouth after using it. How to use the medicine, how many doses you have to give, scientific name of the medicine, what are the risks, the side effects, and what is it used for. And as a nurse, how do you educate your patients on how to properly use the medicine? What to monitor for. Like if they're diabetic, make sure you tell them to monitor their glucose level, stuff like that. So you have to learn about that. We learned about metabolism, transdermal, subcutaneous. We learned about risk factors, all that stuff. What are antibiotics, what are respiratory drugs, how to communicate with people. I'm sorry, I'm just going through all my notes here. We learned about I think just last week we started learning about personality disorders or any kind of mental disorders. That's in pharmacology. We learned about mental disorders and what drugs people use for each one, what are the side effects? Is there going to be hallucinations? Are they going to be dizzy, and what can we do to help them, as nurses, all that stuff. So I thought it was pretty interesting. How I feel so far is that it's overwhelming for sure, because we're only 8 weeks in and there's so much information already. It's accelerated, everything's gonna be crammed together, bunch of tests in 1 week, this week there's a test, next week there's a test, like everything is just crammed and fast paced. It's kind of feels like the school is testing how well you do under pressure, but yeah, I'm just trying to keep up right now. Only 8th week in and I'm still trying to get used to everything. But yeah, so far I'm managing, but could be better. If you've been with me for a while, all my streams, everything, I am the worst at time management, but I have my channel manager or / my friend. He's been helping me how to manage time, what time to do this, what time to eat lunch. Sometimes I miss lunch. I think I'm starting to lose weight because we get so busy and locked in, and Yeah. You get it, it's a lot. But I really love it, you know? You gotta have a passion, you have to really want it. Even though like a lot of people are here for like, you know, money and stuff, because of course nurses make like more than $60 an hour once we graduate. And I hear like even with 2-year degree, once you graduate you will have a job right away because nurses are in demand. A lot of people are quitting. But the hospital, if you work at a hospital or anywhere else when you graduate with a 2-year, they love to hear, or they would want you to continue your education while working there with them, you know? Like, continue getting a BSN, even though you're hired at their place, you know? And I'm sure they're willing to help you. I don't know, that's what I heard, but let's see. And then just today, I hear like a classmate talking to each other. They're saying like, you can actually, since you're a nursing student, you can actually work as a CNA automatically now or something. You don't have to go through school for that. I don't know. I'll have to ask around though. But yeah, there's a therapist at my school that I might try to talk to her about, you know, the struggles I'm going through, which I'm kind of already talking with you guys. But I'm just, I don't know, I'll probably say the same things or maybe a little bit more when I'm with her. I don't know. Sometimes you just gotta let it out, you know? I literally cried during this 8th week, like this, on my 2 months so far, or first 2 months in, and I cried in front of people. I had an asthma attack at home, and I couldn't. It was just so overwhelming. I had an asthma attack. I fell on the floor, and I tried to scream for help, and I couldn't. I think this was the first time that it got so worse. But I hear stories from, you know, last cohort, like my pharmacology professor had to help them as well because they also had asthma. Like 3 people had it. I don't know, like it's very nerve-wracking. You have tests, you know, incoming, you know, like when you least expect it. It goes really fast, so you have to be able to keep up. Yeah, stuff like that. Yeah, that's what happened so far. We got our uniforms. So everyone gets like a maroon colored shirt with a school logo on it. It has to be black pants and either white or black shoes. Nurses have to have their hair tied up. If your hair is past your shoulder, you have to have it tied up. No earrings, no bracelets, no jewelry. You know, just be professional stuff. So yeah, we got our uniforms. Let me see what else. I think that's about it. We're only like 2 months in, so it's still ongoing. I've just been focusing on my homework and stuff so far. But oh, I'm thinking of probably making a video each day or something if I have time. But yeah, definitely there will be more, so please be on the lookout. Thank you for being patient with me. This is my first time, so I'm still trying to get used to everything. And yeah. Let's see. So since we're first semester students, we can't, even though we learned about like injections and IV stuff, all that complex stuff, we cannot do it on real people yet, you know, because I think we start on our fourth semester. That's when we start learning about pediatrics, which I'm really excited about. OBGYN, and I don't know what's in the middle. And then right now we're learning about the geriatric population. So yeah, that's why our first clinical was at a nursing home, which is really interesting. A lot has happened, you know. I really loved it, and I can't wait for more, even though I cry inside every day. But you know, this is my passion, because I also like to help people, and I hope that one day I can be the best nurse, you know, the best nurse that I can be. Yeah, I think that's it. I don't know what else. If I remember anything else, I'll probably say in the next video. But yeah, so I think that's it. But yeah, I've been trying to manage time, find time for gym, to make content, to stream, to I don't know, take care of my health, to sleep. So far it's working, but we're still trying to get used to it because we just recently, you know, we just recently organized all of our time on my list with the help of my manager. Yeah. If you guys have any questions or anything, feel free to say it in the comments or ask. I think the first month I have a 4.0 in nursing school, and the second month is just tests and homework, slowly going down a little, but still keeping up my A's. But yeah, it's slowly going down. But we're still in good standing. We're still pretty high, so we'll see. Yeah, I guess that's it. If you guys have anything else to say, please put it in the comments, and I'll be sure to reply to everyone. Please join my Discord or Twitter. You know, join our comfy family, our Instagram, Threads, all that stuff. Feel free to look at my card where I have all my socials, and I'll keep in touch with you guys. Okay, thanks guys for listening. Bye everyone. Bye.